Welcome to Navigating Life After 40, where we discuss the joys and nuances of navigating midlife. In today's episode, we're joined by a special guest, a functional medicine doctor from Melbourne, Australia, who specializes in helping busy, ambitious women navigate issues like fatigue, body aches, and brain fog. We'll dive into the fascinating topic of inflammation, how it impacts the thyroid health, and perimenopause, and most importantly, what you can do to manage it. Whether you're struggling with unexplained symptoms or simply curious about optimizing your health, this episode is packed with practical insights and expert advice. Stay tuned to learn how to take control of your well-being and thrive during midlife. Let's get started. Welcome to Navigating Life After 40, the podcast that's all about helping women navigate this exciting and sometimes challenging phase of life. I'm your host, Roni Jai, and I'll be here sharing some of my own personal experiences, chatting with experts and a few friends, and also providing some practical advice and support to help you live your best life after 40. Let's get started. Hi, welcome back everyone to another episode of Navigating Life After 40. I'm your host, Roni, and today I am here with Dr. Ailina, who is in Melbourne. Is it Melbourne, Sydney right now? And yes, it is 6 a.m. her time. So I am so grateful to have her here. I know I would be like, I cannot function at 6 a.m. Even though I do get up and try to work out at that time, but trust me, it's a tug of war between me and the bed. And we'll be here chatting with her today about a little bit as it relates to her functional medicine, perimenopause, and thyroid health, and also inflammation, which is one of those areas that we don't often touch on when we're having these discussions. So welcome, Dr. Ailina. How are you this morning on your time, on your coast?
Good morning, Australia. Good morning, America, and everyone else in the world. Thank you, Roni, for having me today. It's such an honor to be on your podcast. Yes, let's get moving.
Yes, I love it. All right, so I want to start a little bit about really helping the listeners understand what is the difference between functional medicine and conventional medicine that we see more so of, especially I know over here in the U.S., we see a lot of conventional medicine. We're starting to see more people practicing functional medicine. So we'd love to just know, what is the difference between those two?
So how I describe it to a lot of my patients is, because I do both, they kind of like marry each other. So we need conventional medicine if you've got a raging infection, if you've got a heart attack, you need drugs, right? And that you're going to die. Unfortunately, where it lacks is conventional medicine is all about patching the problem, like patching it with a pill kind of thing. For example, when I first started learning about this, and that comes from the fact that I've got 2 kids on the spectrum, and I know conventional medicine wasn't doing much. And I used to go back to my practice, and it'll be like verbal diarrhea. I'll tell everyone, oh, there is that. And sometimes when you're diabetic, they just come to your clinic and all they want is a script to control their sugar. So that's what I say in essence is like patching the problem with a pill. You've got a sugar problem, your sugar's high, let's give you a drug to make your sugar go down. How functional medicine works then, it's, hey, okay, you've got diabetes. Is it incurable? No, you can reverse it. How? Lifestyle changes, right? Still take the medication for now, but then start working on your nutrition, on your movement, on your rest and sleep, on your stresses. And that's how functional medicine is going back to the root causes of the problem. And that's how I started with my 2 kids on the spectrum. For my daughter, she's now 25. Oh my God, makes me sound old. When she couldn't speak, the specialist would say, okay, send her to a speechy. That's what we say in Australia. It's a speech pathologist. She couldn't write properly. It was her fine motor. Send her to an occupational therapist. So it's like, I knew there was more to this than just patching the problem. So that's how I got into functional. And then I found out, oh, it's the gut. It's the inflammation in the brain. It's the gut-brain connection, right? So lots of things that not really much addressed in conventional medicine now, but it's getting there. It'll take a while.
So it sounds like what we fuss about. I know over here in the US about doctors, they'll just, hey, here's a Band-Aid, let's slap it on here. We're going to give you a pill and send you along your way. And then in functional medicine, it's more, let's get to the root of problem. Let's really understand what's happening here and start making some changes so that we can reverse some of these diagnoses that individuals have or they're getting diagnosed with. Do I have that understanding correct in a way a little bit?
Yep, that's in a nutshell. And you can't really blame these doctors. We were not taught about functional medicine in my time during medical school. And I think it's slowly creeping in, but it's got a long way to go. These doctors are not trained. So I had to do extra study outside medical school. That's where, and the doctors don't have time. I'm not sure about you guys, but over here, it could be like a 5-10 minute consult. And in that time, you're supposed to talk about nutrition, exercise. No way, just no time.
Yeah, we don't see that a lot over here. It would be nice to have more doctors trained in those areas. Thankfully, we are starting to see somewhat of these conversations taking place just on social media. We're starting to see doctors talk about it and really being honest and open in the way that you just shared. But it would be nice for us to go to our doctors. Hey, I'm having this issue. If they do diagnose us with something, then really, instead of just giving the pill, what are some other alternatives or things that we can do while we're taking this medication so that we can potentially reverse whatever this disease or this situation, this issue that we're having. So it would be nice to have that. But I'm curious to know, how does functional medicine address the unique needs of women navigating midlife?
So much we can do. So the problem now is midlife will be like some people will start to reach perimenopause, and the good or not so good news is perimenopause for some might be a breeze. For other people, it can last from 2 to 12 years. Is that crazy? Again, it's looking back at lifestyle. I always stick to the 5 main things. It's about nutrition. So as we get older, we start to burn less. And there's always this triad that they influence each other during this time of life. It's the perimenopause, it's the thyroid, we call it, where your thyroid gland starts to lower in terms of its function, and also insulin resistance. So all of this can contribute to the factors of you're not burning much in terms of metabolism as you were when you were younger. So that's one huge issue. So we look at nutrition. We look at exercise and movement, because you need to move more. You need to look at, you got to protect the bones, because you don't want to become osteopenic, which is thinning of the bones, and then osteoporosis, which is what my mom had. And she fell, had a hip fracture, too old to be operated. And that's what she succumbed to. So that's a sad thing. And then we look at stresses. Stress is huge. I mean, you could do everything physically for the person. Your blood results might come back really good, and then you're still symptomatic, tired, feel down, brain fog. And then we got to look, because there's such strong connection between things like adverse childhood events, trauma, current stresses. So the list just goes on. Then we look at relationships, because that's so important. Our connection with other people, whether it's our immediate family, our spouse, our kids, extended family, the community in general. That is so important. Our social support, right? Network of support. And lastly, it's sleep. I should have said that first. Sleep is so important for the body to heal, because that's when our body is producing our growth hormone. And some people, I can survive with 5.5 hours. That's what I saw a patient yesterday. 5.5 hours. I said, no. She said, no, it's okay. And then I'll just sleep in on weekends. No, your body doesn't work like that. You need at least 7 to 8 hours. I could go on, but that's the gist of how I would address things.
I love that you look at it from, it's almost this well-rounded perspective that you're taking into account. You're looking at the relationship dynamics, stress, sleep, food, and movement. You're looking at all of these factors. You rarely, if ever, hear a doctor talking about relationships. And I think that sometimes we don't look at relationships as being maybe some of the contributing factors to our health. We hear about stress, of course, but we don't always hear about relationships. And I really like that you address that. I really do. That's amazing.
I always think it's common sense, but I guess it's not stressed upon. And so people don't think about it, but that's a huge factor.
Yeah, and I truly believe that. And as you were speaking, you made me think about there's a nurse, is the only other person that I heard mention relationships now that I think about it. And she was talking about, which is leading us into this next part of the conversation, the thyroid. And she was talking about relationships and for some people, what may have happened in a relationship, some type of trauma that possibly could have triggered these thyroid issues. And so I want to hop into that. We're going to do some unconventional discussions today because I really want to hit on some important pieces here: thyroid, perimenopause, and then, of course, inflammation. I really want to tie all of this together. But I would love to know, what are some common symptoms that suggest that thyroid, for people who have thyroid problems, or how is this something that's often misdiagnosed, I should say? Because I'm noticing that there are some women that I'm seeing in these conversations too, who are being misdiagnosed, or they have all of the symptoms and they're being told you're perfectly fine because the test results came back. Why is this something that's often misdiagnosed by medical professionals?
So you got to think of the thyroid. A lot of people describe it as a butterfly. It's got these two lobes. It sits on your trachea. Think of a butterfly. It's got these two antennas. So it's always looking out for the body's own good. It's what's happening in the environment, what's happening in other parts of the body, and then it's your sentinel gland. So then it's either puts on the accelerator. So there's a thyroid hormone called the T3, and that's to increase your metabolic rate, so burn more fuel. And then it's got the brakes, and that's called the reverse T3. So if your thyroid thinks you're having an illness, whether it's acute or chronic, where if you're starving or you're fasting, but the body thinks you're starving, it tries to conserve because it wants the body to heal, right? So then the thyroid function goes down. It's up and down, and it's supposed to work well. But there are a lot of things that can make the thyroid unwell. And sometimes we think it's the thyroid's problem, but it could be the immune system. There are cases where in autoimmune diseases, we know there's about 100 plus autoimmune diseases in the world now that we know of. Some we can test for antibodies. We've got the blood test to test. Some we have no idea. So like multiple sclerosis, vitiligo, psoriasis, we have no idea what antibodies to test yet. But then the most common one, so 1 in 4 women in their lifetime, you, me, hey, we already make the numbers, right? 1 in 4 women in their lifetime will have an autoimmune disease, and the most common one is called Hashimoto's. And that's when the immune system attacks their thyroid because it thinks it's foreign, and then your thyroid function goes down. And there's another one where it attacks, and it's not as common. It's called Graves' disease, if you've heard about it, where again, it's your immune system, not the thyroid. The immune system attacks the thyroid, and then your thyroid function goes up. The more common one is when your thyroid function is low, and we can test the antibodies. Remember I said some autoimmune diseases we can, in Hashis, in Graves, in rheumatoid arthritis, type 1 diabetes, and other diseases, we can trace the antibodies so we can measure and gauge if you're doing anything. Because in conventional medicine, sorry, you've got antibodies, can't do anything. We'll wait till your thyroid function goes up or down. But in functional, we can, because remember, it's all about root causes. So when you talk about your thyroid issue, and the most common one is low thyroid function, usually it's people who are tired, so it's fatigue, chronic body aches, putting on weight, even though I get a lot of women I'm exercising, I'm eating right, and then we can talk more about that. But say they're doing everything right and they're still putting on weight, the thyroid is one of the probable root causes. There could be other things. As I said, insulin resistance, perimenopause, but that's it. Hair loss is huge. So when people say they're losing hair, that's a common common symptom. Dry skin, dry hair, that's a common one. And then there are other ones, not as common, but can be an issue is some people get swelling, mostly in their legs. That's where it starts. What else off the top of my mind? But yeah, those are the main things people present with. And the problem is you go to your conventional doctor, and I'm not sure how it works in America, but over here, the politicians rule the Medicare system. So there are certain blood tests that will be covered by Medicare and some are not. And so if you just do what the government says you should do, then you're only getting the basic test, which is the hormone in the brain. They're not even testing for the hormone in the thyroid, which is the T3 and T4. And so you get this, and then the problem is in conventional, our reference range is so broad. The reference range for the blood test for the one in the brain, for example, it's over here, it's 0.5 to 5. And in functional medicine, it's 1 to 2 for now. I'm doing more studies with my mentor, and he's come up with more studies that he's going to release soon. And he thinks the optimum level should be tighter. So you go to your doctor, he tests the hormones in your brain that's supposed to have a negative feedback with your thyroid function. And it sits outside our optimum range, but inside his normal range because the whole population is like that. And what do you get? Oh, your thyroid's fine. It's not your thyroid. It must be all in your head. So that's what I always get from patients that come to see me. Do you have similar experiences?
Yeah. I remember in my 30s, I was going back and forth to the doctor. I'm so tired. My legs were always swelling. I just could not do, it was just a struggle to get up every day out of the bed. It was such a struggle. I was still working out, still eating right. And even when I worked out, I would be so exhausted that I just needed to sleep. I was like, I just feel like I need to sleep. I should feel differently. And I was irritable. My face was always puffy. My skin was looking horrible. I noticed I started losing hair on the end of my eyebrow. And the doctor at the time that I was going to, she shared, your thyroid is slightly high, but it's nothing to worry about. We'll keep an eye on it.
I assume that the high was the one in the brain, right? Because it's got a negative feedback with the one in the thyroid. So in the thyroid, hormones are low, the one in the brain will go high.
She never really listened to me. So after a while and just having these tests and I always thought, oh, it's nothing to worry about, I just gave up. And I was just like, I'll figure it out. I'm gaining this weight. I don't know where it's coming from. I'm doing all of the right things. Let me change what I'm eating. Let me slash my calories.
Did it work?
If I eat less, somewhat, but it really wasn't curing the symptoms. But I knew that I couldn't really do a lot. Even if I went out with friends, or at the time I was dating this guy and I was so tired. I don't want to do anything. I would say maybe early 40s, maybe about 42, 43, somewhere up in there. So I gave the doctor another shot. This time I was told, oh, you have hypothyroidism.
10 years later. See how long it takes, right? 10 years later.
Yeah, 10 years later. And so I finally get an answer. And I said, let me do my research. I did my research, learned more about it. And I all of a sudden started seeing more women talk about how they were getting diagnosed with hypothyroidism. And then I heard about Hashimoto's. Never knew. I was like, I don't have Hashimoto's. That sounds terrible. So then recently, and that leads me to a question that I have coming up, but I was still going to my general practitioner and I asked him if he would test my antibodies. He gave me such a hard time about it. He called me on the phone and we got into an argument because I wanted my antibodies tested. So I had to fire him. And I got an endocrinologist. I said, well, let me go to an endocrinologist. I went to her. She tested me recently and found out, I think it was maybe 3 weeks ago, that I have Hashimoto's. And I was like, what is that? I don't want that. And I told her, no, you're just making this up. I don't have Hashimoto's. She said, you do have it. And I said, what can I do to fix it? Because I don't want it. And she said, there's nothing you can do. Just keep taking your medicine and we'll check you again in 6 months. And I was like, okay. But it leads me to my next question, is because how can women really advocate for themselves and the things that they need when it comes to their health, when you are having doctors who are not listening, or even in my case, getting upset because you're asking for certain tests? What are some ways that women can advocate for themselves so that they can get the support that they need from their doctor?
So one of the things is to educate yourself, obviously, these women. Ask the right question. I know Google is a hard one. Maybe come to my Instagram. There's lots of free resources. Ticking the boxes of the symptoms, looking at the tests that you should actually ask your doctor to do. Because Hashimoto's, it takes years. There's 4 stages. And look at you, like only had the antibodies tested now. I'm sure that was has been slowly rising. So why don't we do things, if you are still in stage 1 now, and do things to try to slow down or reverse the process. Then you go on thyroid replacement. You can't resuscitate anymore, no longer will produce any more hormones. So you depend on medication. I think that's the mindset has to change, advocate for yourself, do your research, and then go to your doctor or find a functional doctor. There's so many in the US. One place you can go is ifm.org. So that's the Institute of Functional Medicine. That's where I was trained by. And they've got lists of doctors and practitioners that are certified. And then they can help you to do the right tests. And from then advise you what to do next. So you got to take that first step to fight for your own health. You got to do your own research. And if you're not feeling good, don't let anyone say that it's okay, everything's normal, it must be in your head or whatever. It's just, no, you got to do this for yourself. That's how I would approach this.
Yeah, you're right. And I learned I got diagnosed with hypothyroidism a couple of years ago, but no, it's longer than that now. But a few years ago, my early 40s, then I started doing the research and I started seeing more women talk about it. And I started joining. There were a couple of nurses who had some groups and they teach a lot about it. And I started listening to them on their Facebook Lives and Instagram Lives talking about it. And that's when I started hearing more things. And I'm like, wow, okay, I just thought, okay, they take this blood work. I have to go every 3 months to get tested. So they take this blood work. I take my medicine every day. What tests are out there? And so besides the antibodies test, what are some other tests that an individual can ask for if they're curious to know if they are having thyroid symptoms, or if they do have thyroid symptoms and they really want to know more about it? Are there specific tests that you recommend they can ask for?
Well, you look at the thyroid from 3 points. The first is your gland producing the hormones. That's the first thing. So there's 2 hormones. 100% of T4 is produced by the thyroid gland, but the thyroid gland only produces 20% of T3. And T3 is usually the active hormone that goes and sits on the cell's receptor and tells the cells to burn fuel and make energy. Is your thyroid functioning well? So that's the first thing. Say if it is producing the T4, where's the other 80% of the active T3 coming from? So it's usually converted from T4 to T3 in mostly your liver cells, your kidney cells. Is the conversion happening well? So at least a third of T4 has to be converted. So you need to test your free T4, the T4 that's floating in your blood. You need to test your free T3 and then get their levels. And then there are, as I said, optimum levels. So I have a look at my list, optimum levels, and a third of T4 has to convert to T3. That's number 2. And number 3 is, say you've got all these T3 floating around, good levels. The T3 is a molecule and it then sticks to the receptor on the cells. It's like a lock and key. Only the right hormone will then stick to the right receptor on the cells. Is there something blocking the receptor? So that's when I talk about reverse T3. So you should test reverse T3. Not that it's all bad, but sometimes when you're stressed and you're sick and your reverse T3 goes up. Why is it called reverse T3? I call it's a mirror image of T3. So it looks like T3. If it's more than T3, it fights for this lock on the cell, the receptor. It sticks to it like a lock and key. It's inactive. It's the brakes. And then your T3 is just floating around and can't attach to the cell to tell the cell to burn fuel and make energy. So you've got all, even though on paper, your T3 looks really good, optimum level, it's just not telling the cells what to do because it can't sit on the cell's receptor. I love to draw things, so hopefully that is an image in your brain, but I wish I could draw it up. Anyway, so that's the 3 things. Is it producing enough hormone in the first place? Is the hormones then converting to the active ones? And are the active ones able to tell the cells what to do? So other things like if you're making enough hormones, if your gland's not making enough hormones, why? Is it the ingredients? So then we look at protein, because tyrosine is the T, and then say the 4 in T4, that's the iodine. Are you getting enough iodine from your food? Because that's the problem. I think we lack a lot of iodine in our foods. In Australia, the salt's iodized. I'm not sure about in the US, unless you're eating lots of sushi, seaweed, that's got lots of iodine, kelp. Another thing, looking at nutrients or ingredients, vitamin D is so important in terms of reducing inflammation, which we should talk about. Vitamin D is also important in reducing the autoimmunity, so how much your immune system is revved up and attacking the thyroid, how to calm it down. Then there's magnesium is important in the cells of the thyroid. Iron is important. Zinc and selenium is important for the conversion of T4, T3. So you got to look at all of these tests before you can say thyroid's fine, right? And then address all that, the nutrient debt, and start off with supplements, maybe need replacement, but after a while, look at food as medicine. If you can find all these nutrients in the food that we eat, in the long run, that's better than supplementing yourself throughout life. Because if you're supplementing, it's good for maybe 3 months and then retest. If it's still low, address it. But after a while, if you're taking supplements all the time, it then becomes like another drug, another medication.
Hey, I know you're navigating perimenopause and menopause and you're looking for relief. Well, I have the solution. Go to myalloy.com because they offer personalized plant-based treatments. And here's the great news, honey. They're running a special right now where you get $20 off your first order using code NAVIGATE20. This is valid through October 26th of 2024. Go over there to the website, myalloy, that's MYALLOY.com, and enter NAVIGATE20 at checkout so you can get that $20 off, girl. Take advantage of this now so that you can start feeling your best. And also let me know how it works for you. Would love to hear that feedback. Thank you for breaking that down. No, it was interesting. I was like visual. I love medicine, and I was just visualizing everything that you were sharing, especially when you talked about T3 converting over here. And I was just imagining like these synapses almost that was crossing over to create like this energy or to send this signal where it needed to go. I really love the breakdown and what you shared in terms of really using food to get what we need. You can start off with the supplements, but don't become dependent on them. Look at the food as a way to get what you need. I do know even for myself, I started to increase iodine, but then I will tell you one of the things that I stopped when you were talking. I said months ago, I stopped taking my magnesium the way that I used to. I used to take magnesium glycinate at night and it would help me sleep. And I stopped taking that. And then I was taking an iodine supplement that had kelp in it. And I stopped taking that too a few months ago. And I was really trying to figure out, like, what did I stop doing? Where did this Hashimoto's come from? I've been really beating myself up about it. And because I got some testing done and they started to talk about my kidneys, I think it's GFR or something, my numbers were getting high. And I was like, Lord, I'm dying of something else now. That's where my mind is going. And so when I talked to the endocrinologist, she shared with me, she said, well, this is probably why they're going up because your antibodies are high right now. And so I was like, why are they high? Because what did I change? I didn't have these problems with my kidneys before. I appreciate you sharing, really getting to it while it's at this stage. So now I have something that I can work on, and maybe anybody else who's listening, they have something that they can work on and say, what, let me find the expert who can really help me navigate this issue so that it doesn't become worse over time. And I don't have to become dependent on a medication to give me what I need when I can reverse it now and hopefully heal it through food. Which leads me to another question, because we know, we've been talking about perimenopause for a minute. Some of the symptoms seem to mimic each other, perimenopause and thyroid issues. How do you determine, you as the expert, what is the thyroid versus what is actual perimenopause? Because the symptoms mimic each other, and sometimes, I will be honest, for myself, I felt, oh my God, this is a double whammy because I'm going through both of these at the same time. Now, how do you determine?
So just to retract back about the iodine, because I don't want people to go away and say iodine is good and they just keep taking it. Ideally, if you can measure, it's good. And then you can keep a check on it. And it's usually through a spot urinary iodine. If you can, you just have to be careful. Like, you don't want to take iodine forever. Iodine, yes, remember I said it's an ingredient for T4, T3, like the 4 molecules, the 3 molecules. But iodine in Hashimoto's is also a target for one of the antibodies. Like your immune system, is the ATPO antibody, the anti-thyroxine peroxidase antibody off the top of my head. Anyway, so the ATPO will look for iodine molecules in the thyroid gland and use that as a target to attack the thyroid. It's a double-edged sword in terms of Hashimoto's. So ideally, monitor the iodine so you're not taking too much or too little. So that's my main thing. And we haven't even talked about how we reduce the antibodies, right? If you want, I'll come back to that later. I want to address the perimenopause, the thyroid pause. Remember at the start I said, if you look at the Venn diagram, these three things are interrelated: perimenopause, thyroid, and insulin resistance. So we've talked about thyroid, the symptoms, like when your thyroid function goes down. With perimenopause, it's usually your cycles. So people don't realize how important our periods, as blood pressure and heart rates are, our temperatures are vital signs in men and women. In women, we've got an extra one. It's your cycle. So ideally, you won't have to have a regular cycle, 28 days, and how many days you bleed and ovulate and all that. So unfortunately, when you're on contraception, the pill, the Mirena, it suppresses your ovarian function. And then when you get a period, it's all just a withdrawal bleed. So that doesn't count as a vital sign. So as we know, as we start to go into perimenopause, and that's when everything goes a bit crazy, because when it's menopause, it's back to pre-puberty. Everything's calm, right? It's just this perimenopause period. Now, what happens in perimenopause? Again, I wish I could show you a graph. I might send it to you and then you could share it. It's like when we're cycling, so when having cycles every month, estrogen and progesterone will go up and down, because estrogen goes up and then we release an egg, and then the egg, where the egg was, the follicle that now kinds of crumbles down, produces progesterone. So progesterone is progestation. It maintains the pregnancy, but progesterone is also your calming hormone. So lack of progesterone is good for anxiety, sleep, muscle aches. So when you look at that graph, you'll see that estrogen is just cycling at a very small range. Progesterone is cycling like a big range. And in perimenopause, the first thing that flatlines is progesterone, our favorite calming hormone. So it flatlines first, and that's when people get all these symptoms, whereas they feel slightly good because the estrogen is still going up and down erratically. When it's up, you feel good. When it's down, you get your hot flashes, your night sweats, and your mood swings and all that. So that's the picture that you have to think in your brain of how perimenopause works. So again, looking at lifestyle, and if some people need help and they're worried because all this misinformation about HRT, hormone replacement therapy, you want to try to start off with progesterone supplements first. So it can be the plant supplements that can help. But if you were to go on progesterone itself, you want to have a bioidentical kind of progesterone. And there's a company now, I think it's also in the US, that produces Prometrin. So that's the bioidentical progesterone. You got to be aware that there are other hormone replacement therapies out there that say they are progesterones, but they're actually progestin. So all the synthetic ones have a slightly higher risk of breast and uterine cancer. So you want to help your symptoms, but at the same time, you don't want to get all the bad stuff that comes with it. So I would test the levels of estrogen, progesterone. If you're still cycling, the timing of the test have to be correct. But if you're already perimenopause, you're not having regular periods because the periods will get further apart and scantier, then just do a baseline progesterone and you'll see that it'll be low-ish, if not low. Yeah, and then address that first in terms of, if you want to go down the medication pathway. If not, look at, again, because sometimes you need that to just boost your body's function and then you work on your lifestyle. That's my take on perimenopause. Does that make sense?
It does make sense. Again, you're giving me visuals, so I'm imagining what you're sharing. I'm just imagining it. I was just thinking about a bell curve described progesterone. Oh, it's going up here. And then when we start going through perimenopause, it's coming down on this side. And now we're starting to get moody and hot flashes and all of these things here on this side. So yeah, my mind, I'm telling you, it's very visual. So I'm imagining everything that you're sharing here. I do have a question. Do you recommend HRT at all for women going through perimenopause and menopause, or is that something that you consider as a last resort?
As I said, I would try if you were to go down the medication. I call it progesterone. Like if it's the bioidentical one, it's considered medication. First, before you go onto the combined estrogen and progesterone. In conventional medicine, we are taught that you got to have estrogen because, yes, with the hot flashes and all that, it's lack of estrogen. Estrogen is also important in protecting the heart, the bone, right? And then progesterone is just an afterthought. If you still have a uterus, in conventional medicine, doctors give progesterone to then reduce the risk of uterine cancer because estrogen on its own, one of the causes of a lot of female cancers. Like you got really high estrogen that can then lead to breast, uterine kind of cancer. So we give you estrogen, and progesterone is just an afterthought so that it reduces the risk of cancer. Whereas in functional, we work the other way. Because why I know about this is because some of my patients come to me, I'm telling them this, and then they go to a gynecologist and a conventional one, and they do the opposite, and they get confused. So from a functional point of view, I would start with progesterone. Some people can tolerate estrogen. So always, whatever you do, start low, go slow, and then monitor. But I would do that first. If it was me, I would start on progesterone first and then go to estrogen. Unless this patient is like really affected, the point of it's affecting their quality of life, they can't sleep, really hot flashes and all that, start with estrogen and progesterone, and then work on all the other stuff. As I said, the 5 bits of your lifestyle factors, and then come back and review the medication, and maybe then slowly, because you don't want to be on HRT forever. Remember I said it's just that crazy period, 2 years up till 12 years, and then you feel like pre-puberty again and hunky-dory again. So just to get to that finish line is when you might need a bit of the HRT.
That makes sense. Thank you for sharing that. I do want to ask you this. Is there some form of connection between perimenopause and thyroid symptoms in the thyroid? Or if you have thyroid problems already and you enter into perimenopause, does that impact it even more? Is there a connection there at all?
As I said, I think some people will, if you draw a Venn diagram, the thyroid issues, perimenopause, and insulin resistance all can affect one person with all three, or maybe you just get one or the other. As we grow wiser, older, everything starts to slow down. So some people have no perimenopause symptoms, so it's fine. You're cycling and then that's it. And they might have thyroid issues. Vice versa, someone might have hypothyroid issues, no thyroid issues, and have menopause. It's definitely lead to the other. Not really. Some people might have all three. Some people might just have one. It's just luck of the draw. And also like prevention. If you're really good at taking care of your health, nutrition-wise, movement-wise, sleep-wise, stress-wise, relationship-wise, hopefully you'll ease through all of these periods better.
I like that. Thank you for sharing. Because I was imagining a triangle and I was like, are these interconnected? But like as you mentioned, some people have all three, some people have one, but not the others. And so that's a really good visual to have. Just because you have this, it doesn't also mean you're going to have this, even though there are some symptoms that mimic each other. Just about getting the proper testing done and finding someone such as yourself who understands both sides, the functional side, the conventional side, and who really looks at taking, I would say, more of a proactive approach. I really like that about your style of medicine, your practice, is you're really proactive. What can we, now that we have this, let's be proactive so that it doesn't get worse for you. And these are the ways in which you do it. Before I jump into another section, I do want to go back to the antibodies because you mentioned lowering those. I would love to know, how do we lower the antibodies for the thyroid?
So it's the gut. So if you look at the gut, it's from your mouth right to your anus, right? So I call it from your gums to your bum. And if you stretch it out, it's one long cylinder, right? And the gut does many things. You chew, you break down the food, and then the enzymes come and then break down to the protein molecules, fat, carbs, so that then your body can absorb it, your gut can absorb it into your blood vessels. So that's the gist of the gut. The gut is also the way that things get into your body easily. Unless you were to cut your skin, if you inhale something, most of the time things get in through your mouth, whatever you stuff in your mouth. But the body's not stupid, right? It's got two defense mechanisms. And the first one is, it's a one cell layer of the inner lining of your gut wall. It's called the enterocyte. So you look at it, microscope, it's very thin. And it's got this tight glue in between the cells. They're called tight junctions. You can Google this on PubMed. There's lots of studies, journals on PubMed. And this glue keeps the cells together. And if you think about the gut again, visualize, when there's waste products, it should all come out in your poop. So your gut should be working well. You should poop every day because you want to get all the plastics that might have gotten into your food, all the pesticides, heavy metals, whatever that's not meant to be reabsorbed into your body, it should come out in your poop. So say that's working well. All this, remember this glue that keeps the tight junctions that keep the cells together? They make sure that these toxins don't get reabsorbed into your body, right? So that's one. Sometimes there's a breakdown and there's certain things that can break down this glue. and it's the food. And my two big pet peeves are gluten and casein. So gluten with barley oat rye, casein is the protein in dairy, and it's not lactose. So some people say I'm lactose free. No, that's lactose is sugar in the dairy. Casein is in the protein in all milk. So like cows, goats, milk, and so on. Of course, goat has less. So if we were just to look at these two food, they can actually break down the glue of the cells, and then you have what we call leaky gut. So when the barrier of the cells break down, not only gluten gets in, casein gets in, other foods that might be annoying, your body gets in, because I'm just talking about the top two. There's other foods below that list that can trigger, that can get past your first defense mechanism, right? So imagine that now all of this, and it doesn't happen to everyone. So some people can eat bowls of pasta, drink gallons of milk, and have no autoimmune disease. It's so unfair, right? So what happens in the immune? What happens is these molecules get into the wall of the gut, into your blood vessels. The second line of defense in your gut wall is the immune system. 2/3 of your immune system sits in the gut wall. And imagine that these white cells, your army, staying in the trenches, doing its own thing, and then suddenly you eat gluten or dairy, and to your immune system, that's public enemy number one. So it starts attacking it, then it goes back to sleep. The problem is when you're constantly bombarding the gut with all this food. Now your immune system is all revved up because it's got to do its work. It's got to get rid of this enemy. It can't rest. And in some people, so remember I said this takes years to happen. In some people, then it turns around and looks at certain organs in your body, and in this case, the thyroid, and the system called molecular mimicry, where now the immune system looks at your thyroid cells and say, oh, it looks a bit like gluten or dairy. Let's attack it. So that's how autoimmunity develops. It's not initially the thyroid's problem, it's the immune system. Or the immune system looks at the joints and, oh, let's attack it because it looks like gluten. And that's the basis of rheumatoid arthritis. Or it attacks the lining of the nerves, and that's MS. So the root cause is avoiding these foods. And you don't have to do it forever. So the goal is if you can test your antibodies and go 100% gluten-free, dairy-free, because again, it's hard. It's not an easy thing to do. And then retest your antibodies 3-6 months down the line. Don't test it in a month's time because you won't see the changes. Sometimes it works, sometimes it doesn't. Sometimes there's other foods that's triggering it. Sometimes you need to use other things to bring down your immune system, things like myoinositol, NAC, and things like that. So that's one of the first things I would do if the patient can do it. Some people can't. They find it very hard to go gluten and dairy free. Then I say, choose, which is easier. They say, oh, I love my cheese. I can't live without cheese. Then I said, try gluten first. Yeah, that's in a nutshell, a very quick overview of the connection between the gut and the immune system, and then what happens as a downstream effect.
Thank you for the explanation, because I've been hearing a lot like everything starts in the gut. It happens in the gut. And if we can heal the gut, we can heal a lot of these disorders that are out here. And so I appreciate you breaking that down in the way that you did. I was like really intrigued. Like you had me so intrigued today with all of these explanations. I am curious if with the gut, is that what leads to inflammation that we are seeing with autoimmune diseases and perimenopause? How important is this one of those things? And if so, then how important is it to lower that inflammation?
Inflammation is the swelling, the pain, the redness, right? But then inflammation can also happen in your body. Fat, adipose tissue can be a source of inflammation because it triggers inflammation. And basically, don't think of inflammation as all bad, because inflammation is also your body's way of addressing the injury. So you broke your hand, it's all painful, swollen, red. What do? Then you rest it you fix it, because you don't want to keep moving it, because now it's painful. Obviously, you don't move it. So in a way, it's like your body's defense mechanism to say, hey, inflammation is a way to heal yourself. But at the same time, on the other side, if there's too much, as I said, so insulin resistance can cause a lot of increase in body weight. Fat can be a source of inflammation. Gut can be a source of inflammation if you take lots of inflammatory foods. Again, the gluten, the casein can cause a lot of inflammation. Then there's inflammation in the brain. So people that have like degenerative disorders like autism, things like that. Lots of inflammation that can come from candida growing in your gut. It can come from your environment. So what we're taking, like all the heavy metals that can cause a lot of inflammation, plastics, pesticides. So got to look at the environment, the products that we use, personal products, so our soap, our shampoo, what we put on our face, our moisturizers, our skincare, all those can cause a lot of inflammation. Toxins, basically, toxins that then get absorbed. So you can think of inflammation when you cut your skin, and that's now happening in your body. Some thin people can also have just fat around their organs, so like fatty liver, they can have fat around their hearts and all the other organs. So when you look at someone, even though they are of normal BMI, they still could have a lot of inflammation in the body. So huge. Maybe we'll have to talk about it another day, but in the gist, that's inflammation, and you got to address it again in terms of lifestyle will definitely help. I know I keep harping on the 5 things, and for some it's easy to do. For other people, it's so hard. But all I say is you got to just make small changes. If you've read the book Atomic Habits, 1% change at a time, and after a while, you take about 60 days to get used to this new habit, and then it just becomes part of your daily routine. So a lot of people say, oh, it's too hard to exercise. I'm too tired. I had one client recently. She said all she does, she wakes up, gets her kids ready for school, and then she jumps back into bed. I said, okay, can you add walking to your post box every day? Just one, going to the post box and back, and then slowly build on that. So you don't have to be hardcore crazy like me going to the gym 5 times a week. No, you start at where you are and then build from that. So everything has to be personalized. And then all this inflammation doesn't mean you tick all the boxes and you just got inflammation. Oh my God, what do I do now? So start slowly. Go back to basics. Start from where you are and then build up. Yeah, because all this information might be too much for some people. And then now I'm just freaking out everyone when you just go back to the basics and start slowly.
Thank you for sharing that. And I would love to bring you back for another episode to talk about inflammation and nutrition and those type of things. And I was really hoping that we could even touch on the nutritional aspect today, but I know I cannot keep you forever. I would love to, because I've enjoyed this conversation so much. I feel like I'm in a class just learning. And so I have some things that I've taken with me. I have like sticky notes full of notes that I wrote things down, and okay, I'm going to try that. As we begin to wrap up here, what are you looking forward to or the most excited about in the field of functional medicine? And is there any last minute advice you have for our listeners?
The trend of how functional medicine is going is really on the rise. So I don't have the graph here, but we can see that a lot of people over the years are slowly looking for functional practitioners. So that's a good thing. With social media, there's so much information that we can, share. Of course, there's the good and the bad information. So you just got to pick and choose. So that's been a good help, technology, in terms of helping to make functional medicine more known to the masses. I spread out my functional patients. I love to work fully functionally, but I find that I sometimes need the occasional cough and cold and try this to balance things up. But what I'm doing also, I'm incorporating a lot of my functional practices into conventional medicine, looking at the blood work differently in my conventional patients. They might go see another doctor, get the bloods interpreted, and then they still come back to see me, and I'm like, why are you here? It's been addressed. She said, no, I want to hear your opinion on how you look at the blood work, because sometimes it's just a basic blood work and there's so many things that you can get from that. So that's what I want to say about how this functional medicine, in my point of view, is progressing. I'm learning every day. I'm always purchasing more courses because there's so much advancement in the world of functional medicine, and I can't seem to keep on top of it. There's so many new things, and I'm just learning as you are, and whatever I learn, I try to just share it with my audience.
Nice. I love that. Last minute advice for our listeners, and also how can we follow you on social media?
As I said before, do your due diligence. It's your health, it's journey, it's your own body. If you think something's not right, do your research and see what best works for you. Don't just settle for everything is normal. My main platform is Instagram. I do also work on Facebook, but my main is Instagram. You can find me if you search for me at Dr. for Doctor _Ailina, my name, Ailina. I've got a blog, but most probably everything is more on the Instagram. So my blog is drailina.com, and that's my main website. I work with women discovering the root causes of fatigue, body aches, and brain fog. At the moment, this year I'm concentrating on more on the thyroid, but there's so many other root causes of these three main symptoms that I find a lot of women, like between the 20s to the 50s, that are presenting the symptoms with, and they're not getting answers. So that's how I work. So yeah, have a look. I've got lots of free resources, and reach out to me if you want. DM me and book a call with me if you want. It's free. Bring your blood results to me, and I can interpret it from a functional point of view. That's what you want.
I love that. Thank you so much, Dr. Ailina, for being here today. This was a wonderful conversation, and I do hope to have you back, and we'll discuss that more offline to just talk about other topics. I love talking to you. So thank you for being here. Thank you for waking up so early to chat with me. And that is it for this episode, everyone. Please check out the Facebook group, Navigating Life After 40, and also on Instagram, TikTok, and wherever else you are on social media, Navigating Life After 40, and we will see you later.
Thank you.
That's a wrap for this episode of Navigating Life After 40. I hope you enjoyed this conversation just as much as I did. If you love what you're hearing, be sure to hit that subscribe button so you never miss an episode. And if you're feeling generous, leave me a review on your favorite podcast platform. This helps me to reach more amazing women like yourself who are trying to navigate this amazing life. Thanks for tuning in, and until next time, keep living your best life.